today. Her name is Carnisha, and she fell ill probably a few weeks ago with a sickness which probably a lot of us are not aware of, or some of us have never heard. And she's there today with me today to share it, to share the symptoms, to share her feelings before and after, and what she's still feeling. So I introduced to you Carnisha. Carnisha, introduce yourself.
My name is Carnisha Brown.
Okay. So Carnisha, man, it's so hard to call the name of the sickness. What's the What's the name of that sickness?
It's called trigeminal neuralgia.
Okay. So before we talk what it is,
Okay.
I want you to start from before you know what it is and what you were feeling and how you came to find out this is what you actually got.
Okay, so first of all, I before I start saying all of this, I'm not saying if it's what I was wearing or what causes it because we still don't know fully.
Okay.
But I was wearing Invisalign, where is the plastic thing that you put over your teeth. I had
Yeah.
well, I still have the gaps because they're back. I I was born with gaps, and I wanted to change it as in closing the gaps, and I started wearing the Invisalign for like 2.5 years. I was wearing it, and
Okay.
before I start, if you hear me kind of stutter sometime, I'm on some meds. So it kind of let me kind of have to stop, like, just to figure or think what I'm saying. So forgive me if I'm having a little stutter. Yes, so I was wearing the Invisalign for 2 years, 2.5 years. And I never had any symptoms or anything. I never had any problems except for just pain with the Invisalign, just to arrange your teeth and all of that. And then, I think like a week after I stopped wearing the Invisalign and the retainers where you get the permanent retainers to wear only at nights now, I remember I went to work and I was having these little twitches in my, especially this side, the right jaw. I was having twitches, and I was like, what, you're feeling something different, so you're wondering what it is. But anyway, still going to work and everything. And I remember one morning I was looking after a patient of mine, and it hit me so hard. I screamed out, and my patient was like, I think you need to go to the doctor because I have never seen you, anyways. Yeah. He gave me some meds, some pain meds. He gave me some gabapentin, which is some anti-seizure medicine, and some what they call it, some ibuprofen 800 and some muscle relaxers. To take every 6 hours, the muscle relaxers. Mind you, muscle relaxers are pretty strong. So while taking it, you have to be careful driving and all of that. I was going to school and I was trying to keep dehydrated and everything. And the pain was coming more frequently. And I'm like, something is not right. Went back to my doctor, primary doctor, and he said, I think you need to see a neurologist. Went to my neurologist, and the neurologist told me that I have trigeminal neuralgia. Of course, that big word, it took me like couple of months to pronounce that word because I didn't know what it was. Honestly, I didn't do any research that much about it. All I knew was that it was something. All he told me. So I was going off base. He was what he told me. He said, "Tell you what, you need to do an MRI, but I'm going to give you some meds, and if the medication helps, and you think that hey, the meds are okay, you don't, and it's up to you if you want to do the MRI or not." So of course, I asked him. I said, "What exactly am I dealing with?" He said, "You have, like I said, trigeminal neuralgia." And it's something that you have to live with. You have to be careful how you brush your teeth. Just touching your face, it can triggers it. And of course, by touching my face, it did triggers it. brushing my teeth, I could hardly chew. Just about basically anything that you do over here. You talk too
Okay.
loud, twitches, all of that. But I was having a lot of spasm in my face. When I say spasm, it keeps, a lot of contraction. So
So
went
it was
back
just your face though, or
not
your whole
all,
body.
not all my face. No, it's just right here. Your ear,
Oh,
all the way, yes. So I said, so what do I do about it? He said, there's nothing you can do about it. All you have to do is just take your meds. And then he went up on the dosage.